Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, welcome to our discussion today. I hope you are all in good health and happiness. Today, we have a different topic from yesterday. We will discuss reduction in maternal and infant mortality rates among African Americans, which is related to SDG number 3, good health and well-being. This topic will be presented by Group 1. So, let's meet the team. To help you get to know the presenters better, let me introduce our team. First, Miss Indah will explain the main problem. Next, Miss Fina will present the pro side. Then, I will present the con side. After that, Miss Ari will explain the solution based on both the pro and con perspectives. Finally, Miss Indah will give the conclusion. We hope this presentation will be useful for all of you. So without any further ado, let's get started.
Assalamualaikum warahmatullahi wabarakatuh. My name is Indah Laraswati. In this presentation, I will explain the issue related to the material that has been provided. The high rate of infant and maternal mortality among racial minority groups is driven by unequal access to healthcare and systemic bias. African American women are nearly 3 times more likely to die from pregnancy-related complications than white women, and African American infants have a mortality rate more than twice the national average. These disparities are influenced by limited access to quality prenatal and postnatal care, discrimination in medical settings, inadequate health insurance, and chronic stress related to racism and economic inequality, which together lead to delayed treatment, misdiagnosis, and preventable deaths. Even highly educated and financially stable African American women are still at higher risk, showing that socioeconomic status alone does not protect them. Thank you.
Hello everyone, my name is Fina and now I'm going to talk about why this problem can be reduced. There are strong reasons to believe this problem can be addressed. First, improving access to quality prenatal care help detect pregnancy complications early. The advantage is it reduces the risks of maternal and infant death. Second, addressing racial bias in healthcare ensures African American mothers are treated equally. The advantage is faster diagnosis and better quality of care. Third, support from doulas and midwives provides emotional and physical support during pregnancy and childbirth. The advantage is safer delivers and reduce stress for mothers. 4. Health education help mother recognize danger, psych, and care for newborns properly. The advantage is quicker response to emergencies and lower infant mortality. 5. Improving maternal mental health through counseling and support reduces stress and depression. The advantage is healthier mothers and better infant development. Finally, fair health policies and community support improve access to healthcare service. The advantage is long-term reduction in maternal and infant mortality rates. Thank you.
However, There are several important challenges that make this issue difficult to solve. First, healthcare reforms require high financial investment. Improving hospitals, training healthcare workers, and monitoring maternal care will need large and continuous funding, which is not always available in every state. Second, policy changes can be slow to implement and may face political resistance. Even when new policies are approved, it can take years before they are fully applied in hospitals and clinics, delaying real improvements for mothers and babies. Third, structural racism is deeply rooted in the healthcare system and cannot be eliminated quickly. Changing laws is easier than changing attitudes, and some healthcare providers may still hold unconscious bias that affects how they treat African American women. Fourth, some communities lack awareness of available maternal and infant health resources. Many women may not know about prenatal programs, insurance options, or support services that could help them during pregnancy and after childbirth. Finally, not all hospitals provide equal quality of maternal care, leading to unequal outcomes. This means that where a woman gives birth can determine her chances of survival even within the same country. Because of these challenges, reducing maternal and infant mortality requires long-term commitment, cooperation among healthcare providers, policymakers, and communities, and consistent effort rather than quick or temporary solutions.
Okay, for the next step, I will provide the solution for this issue. My name is Ariyati. As we know the history, African people came to America in 1619 as a labor and as soon as it became a bondman. So why this issue is happening until this time? For the step is equality. American has a super legislation, Black Maternal Health Omnibus Act. The bill consists of 310 individual bill, and the goal is reducing maternal infant mortality, morbidity, and disparities in the U.S. And the second step is awareness. And some state in the U.S. has been officially in 2022 with extended postpartum Medicaid to be 12 months. And the third step is empowerment, building community focused effort and support with the organization for the case. For example, the organization is NBAC, the National Birth Equality Collaborative. This organization is focused the system and structure to contribute to maternal death. And the second organization is the Shade of the Blue Project. This organization is focused for mental health care, and the third organization is System Midwife Production and System Midwife Directory. This organization is offered online in the person doula training along with the community event for the people to learn about pregnancy, birth, and more. And the step pro focus on the Black provider is like prepare Black doctor or midwife professional to caring giving birth for African women, and giving educate on infant sleep, back to sleep, breastfeeding, and vaccination, and encouraging more the professional from diverse background. So this step is helping reducing discrimination in US. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Indah Laraswati. In this presentation, I will present the
conclusion based on the material that has been provided. In conclusion, the high rate of infant and maternal mortality, particularly among African Americans, are preventable through improved healthcare access, strong and equitable policies, and sustained community support. Addressing this issue requires not only medical solutions but also social effort to reduce poverty, improve education, and strengthen family support systems. By combining these approaches, we can save lives, reduce disparities, and build healthier families and stronger communities.
So that's all from our discussion today. On behalf of Group 1, I would like to thank all of you for your attention. We hope our discussion has been useful for all of us. We sincerely apologize for any shortcomings. Thank you for watching and have a good day.